Just giving everybody just a minute or so to catch up, just to join. We'll make a start very shortly. Thank you. Let's make a start, everyone. Firstly, I want to thank everyone for joining us tonight. As we all know, the past 7 months have been incredibly difficult for all of us, and especially those people who've had to really shield, and a lot of us who have lost loved ones. It's been a very, very difficult, traumatic 7 months. In March, we're asked to give up many of our basic freedoms, to change our habits and routines, and basically to stop seeing our loved ones, all to stop the spread of this virus. During the first lockdown, I was completely blown away by the response that was shown locally. Local people volunteered, neighbours went out of their way to help their neighbours. And of course, as people volunteered, they were delivering food, medicine to those in need. And school children and teachers helped make life-saving PPE. I know many of our schools joined in so we could have those visors, which I know the design and technology teams were helping with. It was one of the proudest moments for me as leader of the council, watching all our communities come together as one and support everyone else in our darkest time. It wasn't easy, and many of us made tough choices, tough sacrifices, and in so doing, we helped save lives, residents coming to the rescue. Unfortunately, as winter draws, rate increases, we're once again being asked to change our behaviour, to stop the spread of this virus. I know this is not going to be an easy winter, but I also know that if we all play our part, we can make a real difference. By following the new guidance, we can all help save lives. We've organised this meeting to help share key information on coronavirus, explain the new government guidelines and the tier system, and listen to your questions and concerns, and in particular, to try and get those answers back to you. Firstly, our Director of Public Health, Gladys Xavier, will give an update on the coronavirus situation in Redbridge. Next, Councillor Mark Santos, our Cabinet Member for Health, Social Care, Mental Health and Ageing, will go through the latest government advice and share the information on flu jabs. We'll then move to a Q&A. So let's begin by welcoming Gladys, our Director of Public Health. Over to you, Gladys.
Thank you, Councillor Atwell. Thank you, everyone. So this is the biggest public health emergency we have encountered. It has actually impacted all our lives. I mean, I have been working in public health for a very long time. And the last one I remember was the swine flu pandemic, if any of you remember. I thought it was bad at that time. It impacted all our lives, but this is something I don't think any of us thought. It has impacted all our lives in all areas of life. So you only have to look at the news every day, how it has, how the rates are going up. It's rapidly going up in Northwest, part of Midlands and all parts of the country. So it's also similar to London. So I want to sort of bring it back to Redbridge as we're talking about Redbridge. So the rates. So we actually demonstrate it's actually 176 per 100,000 cases. So a few months ago, that was about 40. So we are one of the boroughs that, and we are one of the 6 boroughs in London, we've got our highest rate. So it's something we have always been concerned about, and we have started taking quite a lot of actions. So we also are seeing, how we do is we look at the last 7 days. So in the last 7 days, we have seen 537 new cases. So that's And in total, from the time we started the pandemic, we have seen over 3,500 cases, confirmed cases in Redbridge. So just to say that also is we will see more cases, because I will go on to about our testing. So we are one of the highest case rates in London, and we are taking lots of local actions how we can control it, and we'll come back to that. So the key messages. We know we're all in the second tier or tier 2, which is really a high tier. So what does that mean for us? So as I said to you, it has impacting all our lives. So we can't really socially meet up with our friends and family. So that's one of the restrictions. And also, unless you can only meet people if you live within the household. So when we made indoor settings, it's in your own homes, in pubs or restaurants, so you can't go out to meet. You can meet people who are your support bubble. So Councillor Atwell was talking about vulnerable people. So you may be looking after people, so you can do that. And also informal childcare is also able to. So you can still meet your family and friends outdoors, but in a group of 6 people only. So that's the rule of 6 applies. And also the advice to reduce the use of public transport, unless you have to. I know some people can't, but if you can. So these are what we mean by the tier 2 regulations or guidance that we all have to follow. So to make a difference, we all have to pull together. So what are the signs and symptoms of COVID? I think most of you know by now is sudden onset. So it's a very high temperature and a cough. When I mean a cough, because we are coming to winter, so we are going to see more of a cold and viruses, that you're going to have sore throat. So this is really a sudden onset. And you will have a cough. But the people I have spoken to, or the evidence suggests that you normally have fits of cough for about an hour, so about 3 lots within 24 hours. And some people also lose their sense of smell and also taste. So if you do have those symptoms, what we say is please self-isolate. That means you could be infections. We don't want you to pass it on to anyone else. So we would ask you to self-isolate and then get a test. So I think when I speak to people, they always say, oh, let's get a test, but do self-isolate. That's really, really important. So once we self-isolate and you can get for tests, we are very, very fortunate in Redbridge. We have got 3 testing sites. So we've got one in Malmö Car Park, in Ganshill, and also in Woodford. So what we say is we don't have, when we first started, we had a walk-in facility. So what I would say to you is, because we have got such a lot of capacity in our testing system, book yourself a test online. So if you go then walk in, you don't have to stand around, you can still get a test. And generally you should get the test results within 48 to 72 hours. There's always the exception to the rule sometimes, but don't panic, you will get it and we will help you to get that sorted. So once you've self-isolated, we would actually tell you that the test and trace system, once you're tested positive, the test and trace system will contact you. So someone will contact you and say to you, have you been in contact with other people? The whole purpose of following up the contacts to break the chain of infection. So in Redbridge, we have even gone further. The national test and trace system, as I said to you, the numbers are so high, they can't cope with the volume. So we want to help our residents and set up a local service ourselves. So we're hoping to go live next week to support the national system. So locally, we know our residents. So we have got the local knowledge. So what we will do is, if they can't follow the contacts nationally, we will contact you. So we will give you more details as we come along. So this is something new we are doing. As I said to you, we want to manage it ourselves. So we are hoping when we contact you from the council and say you've been in a contact, you will self-isolate. So we will also follow you up and make sure you're all right. So we're hoping to do all these things. And the other thing also, we really want to support you because we are in the second wave. So we are seeing a steady increase. So in the first wave, because Redbridge, we're a diverse borough. So we really want to support our residents from Black and ethnic minorities, because we were really affected at the beginning, and we're still at risk. So mainly because there's if we had underlying medical conditions, or sometimes it's just the jobs we do. We are more exposed to the infection. So we really need to be mindful, and we need you to be careful. So when we say to you, you need to self-isolate, that means you don't go out anywhere, that you really protect others, the vulnerable groups as well. And finally, one word of advice. The NHS is still open, so GPs, hospitals, A&E departments, pharmacies. So if you have a non-COVID related health emergency, please contact your GP, contact your pharmacist, your dentist, the hospital if you have appointments. If you've got any screening, immunization for your children or for yourself, always contact your health service. They're open to business. Thank you. So I'll hand over to Councillor Santos.
Hello, good evening, everyone, and thank you so much for coming along to this, our very first public meeting around coronavirus. Whilst it's our first public meeting, it isn't the first meeting that we've held. We've held a number of different meetings with different community groups and community leaders to get those messages out and get those key messages out around COVID and coronavirus. And there will be, we will be shortly announcing our local forum meetings online, and at each of those coming up in the coming weeks, there'll be a session. Part of that will be about COVID and coronavirus, and more opportunities for everyone to hear the messages and to ask questions around living, how we can navigate coronavirus risk. As Jazz and Gladys have said, this is one of the most toughest and challenging of times, and all of us have made sacrifices. And for some, as Jazz said, that sacrifice has just been too high, as many have lost loved ones. All of us have had to change the way we live. It's really frustrating, it's hard, and because it's not how we're used to living our lives, it's not how we want to live our lives. However, following the guidance is a significant part in the way we as a community are going to be able to get through this. And we will get through it. We as a council need you and your help to be able to ensure everyone knows those key ways to prevent the onward transmission of coronavirus. And we need your help to encourage others make this part of their lives too. I know we all know these ways of preventing the onward transmission of coronavirus, but I hope you'll indulge me as I'm going to take us through and rehearse them for us all to right now. The first of them all is space, and that's about making sure that we keep 2 meters apart from one another. And why is that important? It's important because when we speak or when we breathe, respiratory droplets come out of our mouth and our nose, and the virus is on those droplets, and by keeping 2 meters apart, we can avoid passing that on to other people. And that's the same reason that we need to wear face coverings, to protect, to stop those respiratory droplets from passing out of our mouths onto or our nose onto other people. And so in wearing a face covering, you're protecting yourself, you're protecting other people, and other people are protecting you. So it's really, really important, and important to wear those face coverings. In fact, it's the law in shops, on public transport, and our advice as a council would be at bus stops, at school gates, any place where you're in close contact with other people. The other thing to remember is to wash your hands with hot water and soap, and you need to do that for 20 seconds. You can either choose the song Happy Birthday and wash your hands to that, that's roughly 20 seconds, or apparently the Bee Gees Staying Alive is also a similar sort of time level if you want to sing that song whilst you're washing your hands. You must also look after respiratory, take care of respiratory hygiene. And what I mean by that is that if you're going to sneeze or cough, do so into a tissue, or if you don't have one available, into the crook of your arm. Really important, again, about not passing on respiratory droplets which may contain the virus. If you cough or you sneeze, that's actually going to go further than when you're breathing or talking. And as Gladys has said, if you have COVID-like symptoms, it is so important that you self-isolate and that you get a test. And self-isolating is the only way that is one of the key ways, the only way we're going to break that onward chain of transmission. That if you stay indoors whilst you're living with COVID-19, you're not going to be able to pass that on to other people in our community. But self-isolation is tough. We all know that. And for some people, it's tough, particularly to do with the jobs that you might do. And that's why, as a result of some funding from the government, the council is administering a scheme where if you're on low income or on benefits, there's a possibility of getting a £500 allowance for that period of time. And the council also is running a wellbeing service to support people, to give advice, and if in particularly difficult situations, support to help you through that. So remember, it's to keep the space. It's to wear face coverings. It's to wash your hands. It's to remember the respiratory hygiene. It's to self-isolate. The other thing that I want to mention is about the flu jab. And this year, more than ever, getting the flu jab is really important. Because really and truly, people don't want to have both COVID and flu. If you are aged 65 or over, under 65 years with a long-term health condition, a carer, a key worker in health and social care, and all children aged between 2 and 11 years old, you're eligible for a free flu vaccination. Please contact your GP to find out when your next flu vaccination clinic is, or visit your local pharmacy. In terms of children in school, the vaccinations, my understanding is, will take place in school as well. That there is this year, in terms of the school vaccinations, there is an alternate to the nasal spray, which is the better one for children and young people, I've been told. But there is one that one does contain porcine product, and I know that has been off-putting for people because of religious reasons, and also people who are vegetarian or vegan. And there is an opportunity there for you to have for your child to have a vaccination by injection, which you can arrange in talking to your school. As I said earlier on, we need your help to be able to get the message out, to sustain the message in the community, to encourage others about those messages. And one key way that people can help is to become a Redbridge community ambassador. And in the chat is going to appear a link to the Redbridge Community Ambassador Scheme. So I'd really ask all of you, if you haven't done so already, to please sign up to that. And what does that mean? So, well, you'll be asked to give your telephone number and your email, or your email address. And once or twice a week, you will receive a message via WhatsApp if you're on WhatsApp, or by email if you're not, that we want you to share with your family, with your friends, with your wider networks, and to help us be able to pass out information. The other key thing is there, and particularly for today, is to ask questions, because we know how difficult and challenging and interpreting some of the guidance can be. So please do ask questions about that. We also have a frequently asked questions sheet, which is on our website, and probably we'll make a link to in our chat. And we're always updating that. So if there's questions and comments you think about after this event, then please do share those too. Thank you so much. And I think we're now on to our Q&A session. So I'm passing over to the leader and Louise Dibsall, one of our public health consultants.
Thank you, Councillor Santos. We're getting some really good questions being posted. So thank you, Councillor Santos. We're getting really good questions being posted into the chat. I'm going to read some of these out and invite Councillor Santos and Gladys to answer some of these. We will try and get through as many as we possibly can in the time available. So if your question isn't answered, what we will attempt to do is post an answer into the chat as well. So we'll either cover the question verbally and or try to cover it within the chat. So some of the questions that are coming up are really good, and we've got some very concerned residents here as well. One of them is, can we travel to a holiday destination in the UK now we're in a high level tier? We have posted in the chat, but I wonder if Gladys, you'd like to cover that as well, please.
All right, thank you, Louise. So the general advice is we are in a high level tier ourselves, so it's generally not to travel to another, because I think lots of parts of the country are in level 3 and some are still in tier 1. So what we really recommend is not just for general travel, but sometimes people do have to, because they may have sick relatives or some emergency, but always check. But we generally say the whole purpose of, regardless of which tier you are in, is to follow the rules. Then we will contain and break the chain of infection, but it's always to check the guidance. As Councillor Santos says, the guidance changes practically sometimes daily. So we do update them on our website, always check as well.
Thank you. The next question I think is going to be for you again, Gladys, is have testing centres been closed down recently in Redbridge?
No, we haven't closed any testing centres down, because as I said, we are very fortunate for a small borough. We have got 3 testing sites. They have not been closed.
Thank you. The next one is, what is the definition of a bubble or support bubble?
Oh, is that for me?
Sorry, Gladys, yes.
Okay, thank you. I'll try and answer it. A support bubble is someone who is dependent. So if you've got a relative who's living on their own and you do their shopping and you become their support bubble. So you can define bubbles in different sense. So it's so I think the rule changed, so you can have a bubble, somebody who can look after you and if you're in a vulnerable. Again, check the definition as well, because that bubble also is, you know, so we do define. So it could be a classroom bubble. So we talk about bubbles, and the support bubble is actually caring for someone, having caring responsibilities, because you can't leave them on their own. So they need somebody to support them.
Now, here's a really good question, which again, I'm sorry, Gladys, it's going to be for you. How are we able to get a test while self-isolating? That's a really confusing point, isn't it? So you're told to self-isolate if you have symptoms. How on earth do you get a test?
Okay, you can go online and request a home test. They can send it to your home address, so you don't have to go out. So they will post it to your home address and you can test, you can do the test. It's fairly easy to do. You can either, I think there are some designated post boxes you will find saying NHS priority, or you can arrange for a courier to come and collect it from your home. There are lots of options as well.
Thank you. I'm going to invite. Oh, sorry, go ahead.
Can I just add to that? Just to add to what Gladys has said, it's so one of the only journeys, the only times if you've got COVID-like symptoms, you're allowed to leave your house, is to go to the test centre. So you, as Gladys said, you can order a test centre. You can order a test to come to your house, or you can actually go to a test, one of the 3 testing clinics that we have in the borough. But you can't go anywhere else. You have to go straight there, have your test, and come back. And just in terms of the support bubbles, just to go over that, because as Gladys said, it is slightly confusing. A support bubble is where one household can join with another household, but the household is made up of an adult, a single adult. There can be children in that household, but those children would need to be under the age of 13 and under. So a household of multiple people can join with a single household, a single adult household, and that becomes a support bubble. And then there is also another bubble called, there's lots of bubbles, there's also another bubble called an informal caring childcare bubble. And that's where, for example, grandparents might be picking children up from school on a regular basis, taking them back to their parents' house, giving them supper and waiting till parents come back from work. So that's what's described as an informal care bubble, and it can only be between 2 households. There can't be multiple households involved in that and in that arrangement. Yes, that just to give some clarity to those two points. It's just which are all quite tricky to understand.
Thank you, Councillor Santos. Yes, that's really confusing about a bubble, but I think you've explained it really well there. And there is also information on our website about what a support bubble is. So please do look at our coronavirus information hub as well. I'm going to invite Councillor Santos again to answer the next 2 questions. The first one is we're still seeing shops on Ilford Lane with members of staff and letting customers not wearing masks. So the question here is, what are we doing to help support businesses? Councillor Santos?
Sorry, my mute keeps going on. Okay. Sorry, my mute kept coming on. So one of the things that people can do if they're concerned about business is actually on our website, we have a number to report it. I don't know if someone could perhaps put that contact detail in our chat. But we are actually going out and supporting business to be COVID secure and create COVID secure environments, and actually have set up a scheme whereby a business can share with us their risk assessment for how they're doing it, and through that we can give them an external accreditation. We're also enforcing the requirements for places to be COVID secure, and where we have taken action with some businesses and issued fixed penalty notices, and actually with 2 businesses we've given directions which is they've been closed or partly closed because they haven't been heeding our advice. We also have people from our public health team going out and doing some street engagement, encouraging people to wear masks, and when they go into shops, and actually handing out face coverings for people to go into shops if they don't have them. Our advice would be, and what I do when I'm going shopping, is that before I get out of my car, I put my face covering on, and actually if I'm going into multiple shops, that's a much better way of doing it, is to keep your face covering on throughout the whole of that period. And it's also a good idea in terms of the fact that you might come into closer contact with people in some smaller shops or in some more enclosed areas. So the things we're doing is we're supporting, encouraging, enforcing, and engaging with the public around this. But we need your help too. We need to have the peer pressure from others to say, why aren't you wearing a mask? Before I finish on this, there are a group of people who have, because of their health conditions, who were not able to wear masks. So there are some people that are not able to wear masks, and I know increasingly there's badges and ways that people can be identified around that.
Thank you, Councillor Santos. The next question relates to support for businesses. So we have a comment here about a local resident who has applied for a business grant, which has fell through, and wants to know what the council is doing to help support businesses in this financial crisis as well.
I was wondering whether Jazz could answer this question.
Yeah, no, thank you, Councillor Santos. We obviously received some funding from the government, which we distributed, and what we have to do is be very, very careful as well, because we have distributed that money fairly. We've made reasonable checks to ensure that the businesses receive the money that is due to them, because we did have something like 750 fraudulent attempts at people trying to seek access to the business grant fund that was on offer. Now, without wanting to talk about individual sort of cases, if somebody slipped through the net, then by all means contact me. My email is on the website, jazz.athwell@redbridge.gov.uk, and certainly I'll be happy to take that up. But vast majority of the businesses have received the money, and obviously the furlough payment residents have been receiving it, and now the 500 discretionary fund, making sure that people who are self-isolating, and of course there is the infection control fund as well. So there's a lot of confusion around this because there's lots of ways of accessing it, and if residents or businesses are struggling, what we will do is make sure that we will unravel all that mystery. Please do get in touch with me and I'll be happy to take that up for you. Thank you.
Thank you, Councillor Athwell. This is a really excellent question. Are you able to identify where transmission takes place in a street or streets, such as subward data? And if so, can you audit any particular high areas for transmission? For example, where we need to widen the pavement there, have staff in high vis talking to people, put up notices to say, this is a hotspot. Gladys, would you be able to answer that?
Yeah, thank you. Yeah, thank you. That is a really good question as well. I grapple with it all the time. So I get the data every single day. So we look at where these transmissions are happening. In Redbridge, it is happening within families or within family units. So it is not happening so the majority of, because we are mingling and so there's some, it's mainly in the community. So we have had some, I mean, in some other parts of the country, there has been outbreaks in big factories, in other big workplaces, but in Redbridge, because we're a small borough, it's really happening within communities. So you can't pinpoint whether it's in a shop or a street, but mainly within household and within family units. So that's what the evidence suggests at the moment. So we can't pinpoint. I mean, as I said to you before, we have got cases across the borough. It's not just one part of the borough. So we need to social distancing, the hand washing, the face covering, those prevention messages are really important wherever you are to prevent further spread.
Thank you. The next question relates to the first wave and the second wave. Is the situation in Redbridge now worse than it was at the peak of the first wave? And if so, where did we miss the plot?
Okay, so in general, when you have a pandemic, you always have 2 or 3 waves, sometimes even 4. That's a historical pandemic. So the first wave, we were really hit hard. There was a very high peak. The second wave, which we are in now, it's not the same as, we're not seeing that uptick. But what we are saying is a steady increase. So we need to be concerned. So for instance, we saw more cases in the younger age group, but in Redbridge, we are also seeing cases in people over 60. So some of them haven't even been out of their houses, they live within families. So this is the same thing across the country we need to be concerned about. So we do know how it's transmitting, who it is affecting. So it's a steady increase. We are seeing more deaths. We are seeing more hospital admissions. So it's really, these are warning signs for us to do something about it so that we don't see the same wave as going up as the first wave.
Thank you. There's another question here which relates to schools. Obviously, the weather is getting cooler now. And we have a comment from one of our members of the community who says her children are getting rather cold at school as the doors and external doors are being kept open to satisfy the requirements of the risk assessment and ventilation. So even wearing their coats, they're not warm enough. What can schools do about this to stay safe and protected?
So do you want me to answer, who's got?
Yes, please, Gladys.
So if I start, if Councillor Santos wants to come in as well. So if I just start about the evidence as one, because this is a new virus, we're learning about how it's spread, who's affecting, we're learning about it every single day. There's one thing we are very sure about on evidence. Transmission doesn't really happen between the younger age group is mainly from the community, from adults to children. So every school in Redbridge, they have been working hard even during the summer holidays, risk assessing, really putting systems in place to safeguard their children. I know it's going to be difficult, but I am confident schools are getting support from us and from around the council to really support them to make the environment safe for the children, the teachers, and also the parents. As Councillor Santos said, when parents go to pick up children, don't stand close to, wear a face covering. So schools are doing all that. And Councillor Santos or a leader may want to add anything to that.
Yes, sure. I think what we have to look at, as Gladys has just said, is that we have to take personal responsibility as well. As Councillor Santos answered the question on what are the businesses doing, the businesses are generally now a lot more compliant, and what we have to do as residents is to really adhere by the rules, and we clearly aren't. And then there's the schools, and of course the schools are trying to do their best to ensure that the environment is as safe as possible. And I think it's as Gladys said, it's a new virus, and what we're trying to do is basically tackle it in the best way possible. It's a mixture of making sure that there is good ventilation and good heating. And there is also the fact that we have to take responsibility, because my bigger concern is at these school gates where parents are not wearing masks, they're not socially distancing. These are the simple rules, because we have to go past the biggest fires in front of us, and these are the biggest fires that spread the virus. And when we get into the classrooms, I have been reassured, and certainly I will check again with our Director of Education to ensure that we don't have the situation where children are perhaps feeling very, very cold, because that's not a good conducive condition for education. So it is a mixture that we're going to use to certainly tackle this virus going into the winter. And we will take that question up to make sure that if we need to turn the heating up, but then, we will need to certainly make sure that the ventilation is good as well. We will try and do both, because ultimately our only one motive is to keep our children safe and our staff. Thank you.
Thank you, Councillor Athwell. We've got one here that I'm going to step in and answer, actually, of how long is the isolation period now? If you have symptoms yourself or have had a positive COVID test, you need to isolate for 10 days to allow your body time to work through the virus and get rid of those symptoms. However, if you live with somebody who has symptoms or live with somebody who's tested positive, you need to isolate for 14 days. So the rule of thumb is if you have symptoms, it's 10 days from the day of the first symptom. And if it's a contact of a person with symptoms or contact of a person who's tested positive, it's 14 days. And I hope that's nice and clear. We've posted that in the chat as well. Okay. Another question here. What is the council doing to support local restaurants and cafes to increase their outdoor seating areas? And can you help them make waterproof with roof covers because of rain? Maybe Councillor Santos?
I think I'm going to hand it over to the leader.
Okay.
Thank you. I think what we have to do is, again, try and base this on the fact that we need to have safe distancing on our streets as well. When we put people outside, then what we're doing is we're taking up more and more of our space. We've had a general problem on this over the last sort of 15, 20 years, as people as shop have sort of started using up the space outside. And I've seen this problem on Ilford Lane quite a lot. Now, if all the businesses start operating from the street in order to do this, it probably isn't going to work very well, because on one hand, we're sending out messages that we need to keep a safe distance from each other. And at the same time, we're encroaching onto the same footpaths where we're trying to maintain that distance. And secondly, with the winter onset, it's going to be very, very cold outside as well. And this is something we got to sort of knuckle down for the long-term fight. I know lots of restaurants, lots of cafes, they're sort of really dealing with this by having good hygiene standards and good safe distancing. And I think that is probably going to be our best way forward. And of course, any business grants or anything that comes our way, we're making sure that on our council website, we've got the coronavirus hub, all the information is there. And that's where we really need to sort of concentrate on. Thank you, Louise.
Thank you. We had a couple of questions here with regard to public transport and the perceived or real lack of enforcement of face coverings on Redbridge buses. The comment is that bus drivers should be refusing boarding of passengers if there are no face coverings. Is there anything the council is doing to help support our colleagues in TfL?
So one of the things is that we're doing is raising the matter with TfL, where we're hearing about the fact that people aren't wearing face coverings. And as people are aware, unless you have an exemption, you are it is unlawful not to wear a face covering, and you could be subject to a fine. People can, and fines are happening, and on public transport as well. And I think one of the challenges that I've heard that bus drivers and transport workers are having is that people are being abusive to them, and so we would ask is to encourage everyone to support the bus driver, support the transport worker in terms of the encouraging other people to wear face coverings. And I think the important thing about face coverings is that you often see them on people's chins, and actually as I said, the reason that you're wearing a face covering is to stop respiratory droplets from your mouth and from your nose, and so it's really important that those are the parts of your face that they cover. Otherwise, it won't be doing the job, and it won't be effective. So yeah, we are working with our colleagues in TfL, and we are encouraging people to encourage others to wear face coverings.
And just before you come back, Louise, I just want to jump in there also, just to say that the responsibility, unfortunately, has not been passed on to local government. This is a responsibility for the police only. The council generally can enforce the business issues, but if the council office is the enforcement team. If you're littering, spitting, we can issue an FPN. If you drop your mask as littering, we can give you an FPN. But if you're not wearing a mask and you go into a shop, we can't issue an FPN. So what we're doing is we're working with businesses and certainly highlighting it to the police as well. But of course, the police are incredibly busy as well. They've got other jobs to do, which are far really important. And ultimately, it is us as residents who have to take that responsibility, because we are in the middle of a pandemic. And if we still can't see that and people are dying around us, then shame on us. And I think that message has to come loud and clear. We as residents need to take responsibility for our own actions of spreading the virus as well. Thank you.
Thank you. The next question here, I think, is probably best for you to answer, Gladys, which is about many residents concerned about the long wait for a flu jab in our borough.
Okay, so the demand for flu vaccination this year has been quite, the demand has been really high. So what the GPs, you can get it from a GP or pharmacy. There is no national shortage. So that I want to make it very clear. They're prioritizing for anyone over 65 with underlying medical condition, pregnant women, children, they're all being immunized first. So the advice I would give is, because I did speak to our GP colleagues before this meeting, they said, if you've got an appointment, keep it and they will contact you. You will be immunized, but it may take a bit longer. So GP, pharmacists, just keep trying. There is no shortage.
Thank you, Gladys. We started talking about bubbles earlier, and we've had a really good response here that it should be made clear that we can't choose to be in one bubble today and a different one tomorrow. Mark, Councillor Santos, may I ask you to come back to just explain a little bit further about not changing a bubble?
No, if you're forming a support bubble, if you've formed a support bubble, that's the arrangement that you have. Because if you were to chop and change that on a daily basis, you're exposing yourselves and the other household to risk, so coronavirus risk. So you have to keep to the same support bubble. So just as a reminder of what I said earlier on, a support bubble is a single adult can have children under the age of 13 or younger with another household, and they can come together to form a support bubble. An informal care bubble is an arrangement, as I said earlier, where you might have a grandparents or somebody else that is providing some care and support to your children. It probably needs to be, and it needs to be a long-standing arrangement. It's not something that you're creating for the purposes of actually seeing somebody, and that would be breaking the rules. So it's an arrangement specifically and solely for caring for children, and my remembrance is that it's children from 14 and under. So yeah, so I hope that is helpful in terms of explaining the bubbles. As I said, they can be slightly confusing, but you can't mix and match your bubbles.
Thank you, Councillor Santos. I'm going to come back to you again, Gladys, please. The question is, why isn't it recommended for those who can't wear masks to use shields where possible, so the visors instead?
All right, so if you wear a shield, I know it's transparent, but you're still secreting your droplets. So it really doesn't give you any protection. So it's not, you know, in healthcare settings, you will see doctors and nurses who will wear masks, a face covering, a mask and a shield. So it's really because you can still secrete. So you can't force anybody. I know I have seen people who do that, but I would still say like a face covering is the best, where you can cover your nose and your mouth.
Thank you, Gladys. We have a concerned resident who's talking about, if residents witness weddings taking place with more than 15 people, should we contact the council's enforcement team? And what about, for example, if we see parties occurring? We have seen events occur with small crowds where there's been no PPE or social distancing at the Mayfair Venue Banqueting Suite in Chadwell Heath multiple times during lockdown. Is there a Redbridge phone number that we can contact to get enforcement officers down to the scene immediately, or should we call 101? May I ask you to answer that, Councillor Athwell?
Yeah, sure. First and foremost, it is 101. It is police responsibility to be there on site very urgently, and that is the place I would go to as the first port of call. If there is if there's a report it function, but certainly I will get the number that the residents can ring in an emergency to the council. We will certainly take this up because we've got a faster link with the police, and we would like to get in touch. This is something we should not hesitate over, because this virus kills. I've reported numerous sort of parties just going around Seven Kings. When I've come across somewhere, I've reported it, because there is no excuse in this age. It's not snitching, we're actually saving lives. And so any venue which is breaking those rules, please, the first port of call is reported to the police. And in my summing up at the end, I will give the phone number to make sure that if you're going to contact Redbridge Council, here's a phone number that you need to contact. Thank you.
Thank you, that's great. The next question relates back to schools again, so I think Gladys, this may be one for you to answer. The schools, particularly in Ilford South, are very large with big cohorts and class sizes. Many have very little outdoor space. Is this why so many classes have children isolating?
Okay, so as I said to you before, the transmission is very, very, very minimal from children to children. So where as I call a classroom bubble or a couple of classroom bubbles are self-isolating, is because they've been exposed to somebody who's an adult. And as I said to you, most of the transmission is happening in the community. So it's really, again, I will really reiterate the safe distancing, the prevention, the hand washing, all those things, if we practice, regardless of where we are, that we protect.
Thank you, Gladys. There's a follow-up question here relating to younger people, and you've mentioned about the transmission rate in younger people not being quite as high. The question says that if young people are the ones that carry the virus into their homes, what measures are we planning to add and to ensure that young people don't get coronavirus?
Okay, what I did say was we are seeing between the ages of 19 to, the younger age group, so they are affected. So again, I think with this virus, in some cases, you are infectious before you come out with symptoms as well. So if you think about the universities where we had so many outbreaks, so you can't, again, for young people, if they follow the rules, this virus is there, so you have to follow the rules. And also we always urge young people, because if you then catch coronavirus, you will take it to your home and give it to your elderly family, your loved ones. So we always ask people to be careful, and if they do suspect, get themselves self-isolate, get tested, and follow the rules as before.
Can I just add to that, Louise? It's just to say that there has been a lot of work with the public health and the education department and schools in making them COVID secure and COVID safe spaces, and there's been a lot of hard work to do that. And and there's an ongoing support that the schools receive from regional public health and also local public health, and also our education department, about managing coronavirus risk. And when people are sent home, it's taking the utmost in terms of precaution, that they, so often within the group of people that have been sent home, that there's a very limited number of people that actually have COVID, but it's just that they've been exposed to the virus because somebody in that group has had it. So so there's just a small number of people that have been there's a small number of people that are living with the virus or have the virus, but it's a precaution to send a wider group home who've had some contact with it, and that will protect the whole school environment in terms of going forward.
Thank you, Councillor Santos. Looking at the other end of the spectrum, about care homes, we've had a question here that says, what support is offered to our care homes in the borough? Are they protected as the vulnerable in our community? Gladys, may I ask you to answer that one?
Yeah, thank you. Yeah, we are really putting a lot of effort and support for our care home and vulnerable residents, because we don't want to make the same mistakes as a country we made at the first speak. So there's a program to test residents every month and staff every week. So as I said to you before, because sometimes you can be asymptomatic. So if staff or residents, if we test them and they're found to be positive, then they're self-isolated. And we're also very, very careful because we're in tier 2. So we are also very strict about care home visiting. So it doesn't mean nobody can, but however, it's on a risk assessment base. So if you've got a loved one dying in a care home, then we want to support you. So we are doing a lot of things. So there's also, like, we have got support for all schools from public health and also from the rest of the social care team. We risk assess. So when there is a problem solving approach, so we have contact with our care homes every other day. And we have also got infection control support from our own public health team and also from our GPs and our infection control team. So there's lots of support. So we do prioritize them, we do support them, and we really want to make sure that we protect them. And if there is a case, we are having quite a few cases, then we self-isolate them, support them, and to get them out of the outbreak. We work with Public Health England on it.
Thank you, Gladys. Another really good question here that relates to protecting in the longer term is, any idea when the vaccine will be available?
All right, I was going to come to that anyway. Okay, so as residents, you must have seen in the news about antibodies, about in the news today. There's a large study, because originally when we had this pandemic, it started, people thought the more people who got it, so we will have what we call either population immunity or herd immunity. So the more people who got it, we were protected. But now the evidence suggests that is not the case. Even if you had it, it actually drops. So we really cannot depend on that. We are waiting for a vaccine. We are very fortunate. We have got the Oxford vaccine trial. Early indications are that it will be available either by the end of this year or next year. But there will be a priority-based service. So they will probably immunize older group, people are, as in flu, the at-risk group. But just to do that, you can't just have one dose, you have to have two doses 4 weeks apart. So the NHS is planning, so getting ready as soon as it becomes available. The trials are really, really promising. So while that's really promising, I wouldn't still get too complacent, because normally it takes years for vaccine to come on the market after trials. We are doing this within just over a year. So while it's good news, but I would still carry on waiting until, I think in realistic terms, it'll be early next year.
Okay, I'm going to stick with you again, Gladys, for the next one, if I may. If cases are mostly within families, what are we doing within families to help protect other families?
So that's why today's meeting is also, because we have been engaging with our communities. So as Councillor Santos said, we have been doing a lot of street engagement. It's really explaining to people. So when we have spoken to people and explained why we don't want to do that, why we don't want them to do that, people really do understand. So events like this is really for people to explain why we don't want them to do. So the tier 2 guidance is very, very clear about families mixing. So it's about not mixing and taking responsibility for each one of us. We'll just have to keep reiterating the messages. The messages are there. It hasn't changed.
I suppose just to add to that, I think what Gladys is saying is the key change with the tier 2, the COVID alert level high, is that households should not mix inside, and that's a key way of stopping passing on coronavirus to other people. So it's a message to households where people have, and what we mean by household is a place where it's a house under which where people live. Sorry, I shall start that again. A household is a place in where it's considered not your extended family, but the people who live underneath your roof, who reside in your house. And it's really important that we don't mix between households inside, because if a household does have coronavirus, if people in the household do have coronavirus, they should be self-isolating anyway, but if people mix, it increases the risk of that passing on to the wider community.
Thank you, that's great. I'm getting aware of time, so I think we're going to have perhaps just one more question. I'm really sorry that we haven't had time to answer everybody's question today. We will be sending out a Q&A from this and trying to answer as many as we can. But I think a really good one and a very challenging one to finish on is perhaps for you, Councillor Athwell. Many people in the deprived areas are struggling to make ends meet, living in overcrowded housing and finding accessing healthcare difficult. What is the council doing to support them financially and to help them isolate by providing accommodation? Sorry, that's a really challenging one to finish on.
Thank you. And I think first and foremost, you can't answer this overnight, because this is a problem which has been building up for decades. But in terms of deprivation, we made sure straight away, when the government turned their back on, especially the children from deprived backgrounds, children on free school meals, we were the first council to simply just jump straight in and say, no, we're not going to turn our back on our children. We're going to take free school meals and we will deal with it. And I know that we announced this on Thursday. By Friday morning, the system was set up, and over the weekend, over 2,500 children who are on free school meals had actually registered, and that number will have gone up as time has gone on. In terms of financial help, I know what we're doing is we're signposting all the help that certainly we can give in terms of financial support, discretionary grants. We're making sure that our residents are able to access the information which we're providing, like I said earlier, on the website with the Coronavirus Hub. There is numerous number of funds available, and all I would say is that residents need to reach out. Now, if it's too confusing, then that's what we are here for as local councillors. We're here, we're part of the fabric of society. Please get in touch with us, and we will certainly take up each case as we go forward. It is difficult at this moment in time, but we've got to stand shoulder to shoulder and basically make sure we come through this. As Gladys said, hopefully when the vaccine comes either later this year or early next year. And that's what we want to do, not just help the businesses, but especially those residents who are suffering hardship at this moment in time. Get in touch. We will certainly be able to answer a lot more than I can over a phone, over a web seminar like this one.
Thank you so much, Councillor Athwell. I think we're going to draw a close to the questions now, because we've had over an hour. We've had some excellent questions that have been posed. As I said, we will endeavour to answer these questions in a Q&A approach, which will be posted on our website and available through social media in smaller chunks. So I'd like to hand back over now to Councillor Athwell to close this meeting.
Thank you, Louise, and thank you to Gladys and Councillor Santos. I just want to be clear that we've had the meeting today. We've got the local forums coming up. Please join in on those forums. They're your network to talk to us whichever way you can. Send us emails, reach out to us. We're here to help. And can I just thank you all for joining us today and those who submitted the questions. If you have further questions, like I said, email us directly. Our contact details are on the Redbridge website, and certainly we're very, very accessible. On the website, like I said, there is also the general information on the virus itself in our Coronavirus Information Hub, and the FAQs are on there, so you can get a lot of information from the website. This pandemic has challenged us all to live differently, to change our habits, and to be more mindful of all our behaviours. It hasn't been easy, and we've seen that we've got to actually do things differently. We've got to make a difference if we're to survive through this, whether it be by washing our hands or wearing masks, or stop the spread of the virus, or volunteering to deliver food to our neighbours in need. It's up to us as human beings to come together, to play our part and keep our friends, our family members, our neighbours safe. Thank you very much for tuning in today. Have a safe rest of the year. Before I get muted, I did say, and I forgot in my excitement to finish there, if the residents are still on there, and I will tweet this as well. I did say that there would be a phone number. And the emergency number for ASB 0208 554 5000. That's 0208 554 5000. Thank you. And of course, there's the report it function as well. Thank you.